The virus behind COVID-19 is in the air. That's the main way it spreads. Unlike other hazards, the source is a person. When someone's infected, they can share the virus particles when they breathe, talk, sneeze, cough, or sing. Many people do this without symptoms or before they get symptoms. The small particles can stay in the air for a long time and go much further than the 2 meters or 6 feet we've heard about, especially indoors. Think of them as behaving like smoke. So that's why we're more likely to inhale the virus when there are more people together in enclosed spaces for longer times, sharing the air without effective ventilation or respiratory protection. Vaccines are necessary, but we need more layers to protect us from the virus. We need the best possible from each layer we have. There are things we can do ourselves and things that others, including employers, need to do. Good ventilation is essential for enclosed spaces where we work and live. Filters and fresh air reduce the amount of virus in the air and protect groups of people. Masks, especially respirators, also are important to protect us individually. Francisco, a farm worker in the Bradford area, volunteered to look at them with Liliana from the local support group Unknown Neighbors. 3 things matter for masks and respirators: fit, filter, and function. Francisco's surgical or medical mask is designed to stop surgery staff spitting on patients or inhaling large particles from them. It's really easy to put your fingers in the sides of these masks. When that happens, what we exhale gets in the air, as the video shows. It escapes around the sides and other parts of the mask where there isn't a good seal to the face. A mask only works right if the fit is tight. Liliana had a gadget that could help. There are other devices like this, or you could make something yourself. The idea is that it pulls the straps or ear loops back so that there can be a tighter fit, particularly along the sides. Francisco checked and said yes, it was harder to put his fingers in, so we know he's getting a bit better fit. But it's not good enough. A mask needs to filter out the virus particles. Respirators are the only masks with a special material that does that. So, for fit and filter, respirators are much better than other masks, as the graphic shows. And they still let people breathe pretty easily. That's function. It takes training and practice to put on and wear a respirator. Here's how it's done. Start by pulling the folded respirator apart. Good respirators have 2 straps, not ear loops, so you get a better fit. Be sure the straps are on the outside. Hold the part with the metal strip with one thumb and finger, and the bottom with the thumb and finger of your other hand. You might find it easier to put the bottom part under your chin first. It doesn't matter whether you put the top strap over first or the bottom strap. We use the top strap approach. Then pull the top strap over your head. It should be firmly in place, and the respirator will be covering your face. Next, pull the bottom strap over your head and around your neck. If hair gets in the way, pull it over so the strap is right against your skin. Make sure the straps are flat and not twisted. The panel should be unfolded all the way out. We want to make sure the respirator fits right against your skin, that it seals well. Take 2 fingers from each hand and press the metal strip where the nose meets the cheeks. You don't want to pinch the top with just 2 fingers. That can end up leaving a little space, so you won't have a good seal there. It should be comfortable, as Francisco found it. He does have a little hair on his face. That may stop the respirator from giving him a good seal against the skin. There shouldn't be any hair around the outside edge of the respirator, or there are little spaces where the particles could get in. How do you know if there's a good fit? At work, employers should do fit tests for everyone wearing a respirator. That takes special equipment. Without a fit test, a respirator still protects you better than other masks do. It's less accurate, but you can check the fit yourself. Put your hands over the respirator, then breathe in and out sharply without moving the respirator. If it doesn't have a good seal, you'll feel air escaping. If air leaks around the nose or your glasses get fogged up, adjust the metal strip so it fits more smoothly against your skin. If air leaks from the sides, adjust the head straps. Do this each time you put on a disposable respirator like this. If you're going to wear a hat or something else on your head or around your neck, put the respirator on first. So how do you take it off? Gently hold the bottom strap and pull it carefully over your head. Particles should be trapped inside the filter material. Try to touch only the straps. You can reuse a respirator, like the N95 or N99, as long as it's not dirty or wet. Store it in a paper bag for 4 or 5 days, and use a different one each day. Check the straps regularly. There are fake respirators on the market. Real ones are certified. In North America, most of them are approved by NIOSH. Health Canada also authorizes some respirators. And there's a brand new Canadian standard. Look for respirators that say CAN-N. We used a disposable respirator, an N99, for the demonstration. It's like an N95. There are other kinds too. Some protect even better. So what really matters? The virus is in the air. We need multiple layers to protect us from those airborne particles. Masks are not all the same. When it comes to masks, respirators are the most efficient way to protect you and others. Until you get one, make sure what you're using has a tight fit.